Good evening, everyone. We are going to talk today about leptospirosis. It is a very important globally spreading zoonotic disease caused by a spirochete, Leptospira interrogens. We'll study the etiology, the mode of transmission, the pathogenesis, the clinical features, and the investigations and the management of the same. So, starting first with the etiology, as I told, it consists of Leptospira interrogens. The source of infection is rodents. Rodents are the reservoir for it, followed by dogs and foxes. Coming to the mode of transmission can be direct or indirect. Indirect, if it's the infective urine is touching the abraded skin, mucous membranes, it can spread and enter into the bloodstream. Or indirect is ingestion of contaminated water and soil. Incubation period is around 1 to 2 weeks. Coming to the pathogenesis, there are two phases. First is the septicemic phase or the leptospiremic phase. After the entry in the blood, the the organism proliferates and there are flu-like symptoms. The patient presents with fever, malaise, photophobia, and conjunctival suffusion. The conjunctiva is red but without any exudates. Coming to the second phase, which is the immunological phase, there, due to the body's immune response, antibodies are formed and the infection starts residing. And in this phase, you can actually detect antibody titer positive, and meningitis is seen in this phase. And there is a subgroup or a severe complication. It can develop in the leptospirosis second phase, which is known as wheel syndrome. It has a classical triad of renal failure, jaundice, and hemorrhagic manifestations. AKI is seen in 50% of the patients suffering from Weil's disease. It can be oligouric or non-oligouric. And in jaundice is seen in few percent of patients, and hemorrhagic manifestations like petechiae, purpura, ecchymosis, pulmonary hemorrhage, hematemesis, melena is also seen. Other features, as mentioned earlier, meningitis can be seen, myocarditis, TTP, uveitis is also seen in rare cases. And the most common cause of mortality in leptospirosis is multi-organ dysfunction. Coming to investigation, in urine examination, we can demonstrate the organism. In the dark field microscopy, we'll see tightly coiled spirochetes with a hook at the end. Other investigations include serological tests like testing for the antibodies, and for the treatment we give, in the mild phase we give doxy and amp orally, and if the disease is severe we give IV penicillin or ceftriaxone. So this was all about leptospirosis.